guys, today I am going to give you a mandatory points to be remembered during basic life support program. Usually this BLS has two big division. The first one is CPR and the second one is relief of foreign body airway obstruction. Regarding CPR, it's a combination of action which includes chest compression and the respiration to save the life of the person. Based on the age group, the CPR features will be vary. There are three types of age group. The first one is infant, less than 1 year old child comes under infant. Then 1 year to puberty will comes under child. Above puberty will comes under adult. I'll tell you the scenario and also steps we should follow during that situation. If you found a person in the roadside and he seems like collapsed, immediately we have to check the scene safety. If there is any fire nearby the site, we have to bring the patient to the safest site and keep the patient in the firm surface. Next, we should check the responsiveness of the patient. If there is no response, immediately we have to call for help and ask them to get AED. Next, we should check the pulse and respiration of the person within 5 to 10 seconds, not more than 10 seconds. If there is no pulse and respiration, immediately we have to start chest compression 30. Then after 30, we should give 2 rescue breath. This is one cycle. Likewise, we have to complete 5 cycle. After that, we have to check the pulse and respiration. In between, you got help from the person, you asked for help. You received the AED. After the 5 cycle, we have to check the pulse and respiration. If there is no pulse and respiration, we have to apply the AED. We have to on the machine first and it will give all the information one by one. Then we have to check the pads. Apply the pads over the chest, one on right upper chest and the next one should be left lower lateral side of the chest. Then it will analyze the rhythm and it will deliver the shock. If the patient needs shock, it will instruct us to press the button to deliver the shock. If the patient doesn't need shock, it will give us an instruction and after that immediately we have to start the CPR. After delivering the shock also, immediately we have to start the CPR. Then after completion of 5 cycle, no need to check the pulse and respiration because the machine will read and analyze the rhythm and it will give instruction whether the patient need shock or not. Regarding chest compression and the respiration ratio for the adult, 30:2. If you are a 1 rescuer, 2 rescuer or more than 2 rescuer, that doesn't matter. The victim is adult, we will give 30:2 ratio. If the victim is children or infant, we should give 30:2 if you are a 1 rescuer. If you are more than 1 rescuer, you should give 15:2, 15:2. Chest compression and the respiration ratio will be vary from adult to pediatrics based on the rescuer. And the depth for adult is 2 to 2.4, not more than 2.4 inches. For the pediatric, 1.5 to 2 inches. Next, when we are doing CPR to the pregnant women, we should follow LUD technique, lateral uterus displacement. We have to stand right side of the person and push the uterus left lateral upward position. So it is used to relieve the compression of inferior vena cava and the aorta. These are all the main points and the steps we should keep it in our mind during BLS program. In my next video, I'll share about the Heimlich manual and relief of foreign body airway obstruction. Thank you for watching.